Hello everyone, my name is Alejandra Perez. I'm a microbiology student, so today I am going to talk about Propionibacterium acnes. And with Propionibacterium acnes is a bacteria that is associated with acne. Propionibacterium acnes is a gram-positive, anaerobic and non-spore-forming bacteria that is involved in the pathogenesis of acne. Acne is one of the most common skin diseases, affecting more than 40 million individuals annually in the United States, but it is usually the least severe. It affects many people around the world regardless of race or gender, but especially young people between 12 and 24 years old. It is estimated that nearly 20% of all visits to dermatologists are related to the treatment of acne. Four major recognized pathophysiological features of acne include androgen-stimulated seborrhea, hyperkeratinization and obstruction of the follicular epithelium, proliferation of P. acnes, and then inflammation, which is translated to whiteheads, blackheads, oily skin, red skin, pimples, and scarring. In addition to this, one of the non-physical symptoms that may be included are low self-esteem, depression, frustration, and social distancing. Acne does not come from anybody other than ourselves. Propionibacterium acnes are bacteria that are present on the skin. This bacterial species are part of the normal microbiota of the skin, oral cavity, and gastrointestinal and genitourinary tracts, and are usually not pathogenic. Acne is not contagious. There are some skin problems that are contagious, but acne isn't one of them. Common acne, what's called acne vulgaris in med speak, can't be passed from person to person like a cold or flu can. You can touch, hug, and kiss someone with acne without fear of catching the skin disorder. Life cycle of the pathogen consists of 3 stages. The first one is called clogged pores. Each pore of our skin is essentially a hair follicle lined by cells from the epidermis. The hair follicle is connected to multi-lobed sebaceous glands, which are glands that produce oil. These glands at the same time produce sebum, a natural lubricant of the hair that provides lipids and essential fatty acids that are necessary to maintain the skin healthy. There are cells that line the pore and are always peeling, and they mix with sebum and flow out of the pore onto the skin. But when this does not happen, and if the sebaceous gland is producing too much oil, the dead skin cells and sebum block the pore opening, forming a plug. The second stage, bacteria, takes place when dead cells and excess sebum attract Propionibacterium acnes, which, as I mentioned before, is naturally found in our skin. The last stage, inflammation, is when this bacterial growth triggers the natural inflammatory human response, causing redness, swelling, pimples, and scarring. Acne often debuts during changes in hormonal levels in preteens. However, it is also very common as an adult-onset condition, often associated with hormonal fluctuation during the menstrual cycle and pregnancy in addition. It affects many people around the world regardless of race or gender, but especially young people between 12 and 24 years old. However, 80% of people suffer from acne at some point of their lives during adolescence or adulthood. To diagnose acne, it is necessary to go to a dermatologist, but no lab work is necessary. However, the dermatologist can perform a lab test in order to know the hormone levels. Blackheads, whiteheads, or seborrhea of the face are some of the types of injuries that help diagnose acne. For the diagnosis of acne, it is important to study the patient's history that refers to this problem on the skin. Duration of the lesions from weeks to months, and even years. The dermatologist will perform a physical examination including the type of injuries of the patient, form of the injuries, and where they are located. There are a wide variety of over-the-counter treatments on the market, but they are usually not as strong as those prescribed by a dermatologist. The secret to control acne is prevention, because acne begins 2 weeks before blemishes are visible. Prevention includes exercising, eating well, and having a good cleaning routine. Acne can take up to 12 weeks to treat, and it is necessary to unclog plaques, keeping them clear, and control oil. For severe cases of acne, treatment regimen to successfully eliminate the remaining bacteria, most authors suggest a course of 3 to 6 months of antibiotic treatment, including 2 to 6 weeks of intravenous treatment with a beta-lactam, if necessary.